So this is Eddie's first time getting ultrasound and stim. What do you think, Eddie?
Yeah, it's pretty interesting. I mean, I'm trying to like fight myself not to like jolt around.
Trying your hardest to relax.
Yeah.
But at the same time, it feels pretty good, right?
Right.
Hey everybody, it's Mike here from Kalkstein Chiropractic, here to announce an exciting partnership with Bob and Brad here in the office. We're super excited about it. Like you guys all know from our YouTube channels and our videos, we love doing heat and stim. We love doing hot therapy, hot moist therapy especially. So one thing that we're doing today is we are talking about our Bob and Brad heating pad. So we've got Eddie here today. Eddie is about to get some therapy on his low back. So what better way than to break in our new heating pad from Bob and Brad. One of the really cool features of this heating pad is it has a remote. The remote actually goes in 30-minute time increments, like you can see. It also lets you control the heat of the product itself. It's a really great product. We're really enjoying it. The quality is awesome. Even with the fabric here itself, you can actually even spray water onto it, so you can get a little bit deeper of penetration with that heat, as opposed to just dry heat. You can add in that moist heat layer. Like I said, it's a really great product. We're really excited to have it here in the office. And come on in, guys, if you want to check it out or if you want to see their stuff in action. Hey everybody, it's Mike from Kalkstein Chiropractic. Got Eddie here with us, and this is part 2 of our Bob and Brad video. So like you heard in the previous section, Eddie's got a little bit of low back muscle spasms going on. Been treating a lot of patients here this morning, so we're giving him a little bit of relief. First section, we did the heating pad from Bob and Brad. We had a little bit of moisture on there as well, so we're getting that nice moist heat penetrating a little bit deeper than, you know, just the regular heating pad. So now we're going to go ahead and get him some ultrasound and stim. Really get those muscle spasms calmed down just a little bit for him. Alright, so we'll have a nice fun video here too, because like you guys know, with the ultrasound and stim, we get those nice muscle twitch responses. So Eddie, just let us know when the stim there starts feeling strong but comfortable, okay?
Mm-hmm.
I can see him moving on the table a little bit already. You starting to feel it, Eddie?
Oh yeah.
Perfect.
That's perfect right there.
Right there?
Yes, sir.
Okay. So we've got our grounding wire right there, so you'll notice as we get a little closer to that spot, some of those twitches will kind of pop up a little bit more.
Oh, yeah.
He's dancing around the table just a little bit. The ultrasound and stim is a very interesting feeling. It's a nice combination between ultrasound itself and then obviously the stim, but from what I find is you get a little bit more of that muscle twitch response. You can kind of see he's got a little bit of a shaking sensation going on here in the low back, a little bit in the QLs. There's some nice spinning there. Eddie's really fighting the beast for us right now.
Yeah.
You can tell he's trying to be tough with the stim. So anyways, while we're joking around and saying that twitching and the responses are uncomfortable, they actually do help with the muscle spasms that he's getting going on right now in the back. So this will be a short little treatment, about 5 minutes long, and then afterwards we'll get Eddie out to the exercise floor. We'll have Eddie doing some therapeutic movement, really restoring movement into the low back, get him going through some extensions, and just really getting the back moving the way it should. In our case here at the office, we kind of spend a lot of time in that flexion position because we're bending over patients, and so that's essentially what Eddie needs to kind of work himself out of. He needs to restore himself with a little bit of extension-based exercise.
Mm-hmm.
So this is Eddie's first time getting ultrasound and stim. What do you think, Eddie?
Yeah, it's pretty interesting. I mean, I'm trying to like fight myself not to like jolt around.
Trying your hardest to relax.
Yeah.
But at the same time, it feels pretty good, right?
Right. Can't complain.
Yeah, this is definitely a good coupling modality if you're getting muscle spasms, if you're just having some acute pain. It's really good to kind of calm everything down. Alright, well, We are almost done with the ultrasound and stim here. Like I said, coming up next, we'll have Eddie going through some exercises, restoring that movement in the plane that he's kind of been neglecting today. And then we'll get him into a doctor's office, or a doctor's room rather. We'll get him an adjustment and we'll get out of here. Everybody, we will see you on the next round. And once again, thanks Bob and Brad for the great products.
Thanks, Bob. Thanks, Brad.